how do you think, can we change this report card moving forward?
Well, I think, first of all, I think we should congratulate the authors of the report and the people who are committed to producing this data, because you have a study like, and Julie will be aware of this, the Million Women study, which completely ignored same-sex attracted women. So there was this massive opportunity of a huge longitudinal study of 1 million women, literally, and they forgot to ask that question. And so, you know, we at least have a world unique project here where we are getting some data. Through that data, what do we do? What do we need to do? We need to set priorities, and clearly the priorities are coming through quite manifestly. Things like screening, cervical screening, for example. Mammograms. A number of lesbians who've said to me, oh, I went to this other doctor and he said, you're a lesbian, you don't need to have a pap smear. Now, fortunately, that mentality appears to be subsiding and education is improving in that area, but nonetheless, you still get people who are put off going to see their GP for routine testing because they don't want to have that conversation. They don't feel comfortable with the GP that they have, or they've had a bad experience, and that has put them off going to see a GP. So I think number one is we need to upskill medical students, and we need to upskill doctors who are working in general practice in particular, but also right across the specialties, so that they're not only gay friendly, because I think most doctors would consider themselves gay friendly, but gay competent. And I think that there's a big difference between gay friendly and gay competent. And, you know, a lot of doctors sort of think they're kind of hip to the groove and stuff, but, you know, then they ask really dumb questions. And it makes people feel very self-conscious if they're not, you know, not everybody is very confident with their sexuality. And so that I think is an impediment to screening. And when you consider that the numbers in terms of cervical screening in particular and mammograms are a lot lower than the general population, and that's one issue. Mental health is another major issue that we need to address. And when you consider that the numbers here, that 8% of women report high psychological stress, 42% have had a mental health diagnosis in their lifetime, and 64% have accessed psychological services in their lifetime. Now, it's not because being gay or lesbian is bad for your mental health. It's the reaction to being gay or lesbian that is bad for your mental health. And we would all know we would all have friends who have had major issues in their family related to their sexuality. It doesn't happen in all families. Not everyone's got mum like Shelley, sadly. But I think that we need to really address these issues you know, we need to address these issues around mental health, what is causing mental health problems for lesbians. And that really comes down to community and family, I think. And, you know, that's not purely a health issue or medical issue, but you know, health issues best defined take in everything, including your social, your cultural context, your spirituality, and everything to do with your environment. So I guess the obvious things are smoking, alcohol, drug use, and they're things that we need to have specific targeted campaigns in public health for. But there are these other more subtle issues, and, you know, we heard earlier from the girls who had dinner with the Prime Minister yesterday, and gay marriage equality is a health issue. There's no question in my mind that until we eliminate all forms of discrimination, that doesn't send the signal that it needs to be sending to families and to individuals about how we should be respected.
Absolutely.